Just got your CSEC results? Awaiting CAPE? Considering university? Not sure you can afford it? ABE is an alternative for you. The Association of Business Executives has partnered with Distinction College to offer its Level 4 Business Management qualifications. You can now achieve 120 university credits for a fraction at the price at Distinction College. And remember, it's as easy as ABE.
Today we'll be looking at COVID-19 or coronavirus and some of the effects and some of the psychological, because there's a lot of psychological effects that is included with the virus. So not only the physical effect, but there are also psychological effects. Okay? Now, the ongoing COVID-19 outbreak is in many ways unprecedented in the scale of its challenge, the scale of public health response, and the historical context in which all this is unfolding. Now, COVID-19 is the first global pandemic of the social media age. Now, yet for all that is new about it, COVID-19, the disease still behaves like any number of prior epidemics. Now, it is, for example, similar to the 2013 severe acute respiratory syndrome outbreak, SARS, an event which created a number of lessons for our present moment. SARS was in many ways the best case scenario for responding to a global infectious threat. The spread of SARS was contained fairly quickly by public health efforts, chiefly through the widespread use of quarantine. But even this relative success still had consequences for mental health. In 2004, a study of SARS control and the psychological effects of quarantine was done in Toronto, Canada. Now, although this is a different country, the effects is basically the same. And so we're saying that there are some amount of psychological effect that will be happening right now and that will continue way after. Now, it was revealed that among quarantine persons, a high prevalence of psychological distress, including symptoms of depression and post-traumatic stress disorders. Now, a key takeaway is that even if we can halt the physical spread of the disease through the expeditious use of quarantine and social distancing, we will still have to contend with the mental health effect in the long term. This is a message that is frequently forgotten. Now, the mental health effects COVID-19 can shape health for many years, long past the event that precipitated them. We have been focusing correctly on saving lives and mitigating the short-term consequences of COVID-19, but the long-term consequences may be equally, if not more, important. Now, while it can be difficult to take a long view when the event of the moment is so compelling, it is necessary. It is necessary if we are to ensure the steps we take now are the best interest in the public health. Once this pandemic passes and our task moves from response to one of recovery. To envision how long-term future may unfold, it helps us to look to the past, not just only at past pandemics or epidemics, but like protests, riot, and uprising. For example, the Tivoli Gardens incursion in 2010. It affected the citizens years after and might still be affecting persons to date. Now, also natural disasters such as storms and hurricanes where persons might have lost a loved one or a personal belonging, like their homes. This can affect persons long after the event. Even when the physical evidence are long gone, they're still affected by the memory. Mental health consequences can include depression and substance disorders. A lot of persons, when they get depressed, they smoke, they drink, and a lot of this can have long-term effect. Now, given the potential long-term mental health consequences extending well beyond the duration of the pandemic, what steps can we take now to safeguard mental health? Now, first, it is important to disseminate accurate, up-to-date information on COVID-19, to counter the misinformation that can lead to undue fear. Now, second, we can care for friends and family members that are at risk, special risk. And these may include persons with pre-existing mental conditions such as depression and anxiety. And also the children, they're also vulnerable. Now, third, we have a special responsibility to ensure we are positive to the mental health needs of people acting as first responders and care providers or persons affected by by this pandemic. Now, given the potential for... Now, finally, we need to realize that we are all in this together. But no one should have to feel alone. No one should have to feel alone. As we continue to use social distancing in the coming months, we should also reach out in whatever safe ways we can, letting one know that family members, friend, letting one know know in our lives that though perhaps we're physically isolated, they remain embedded in a web of care and concern. Our health, both physical and mental, is linked. When trauma strikes a society, it does not just strike a group of individuals who happen to live in the same place. It exposes how connected we are. We want to be compassionate. Okay? It is compassion and simply looking out for each other that will support health, physical and mental, in the coming days. Now we're going to look at some basic information on COVID-19. Again, the more we know about the disease, the better we are able to safeguard ourselves. Okay, so what is COVID-19? COVID-19 is a new virus called Severe Acute Respiratory Syndrome, SARS-2. Now, this disease was about back in 2013. Now it is now here again. This time it is a more potent virus. It's the SARS-2, right? So it's more dangerous than the one that we had before. That was before. Now it was identified as a cause of disease outbreak that began in China in 2019, November 2019. Disease is called the coronavirus 2019 because it was actually found in 2019. Okay, some of the symptoms. Sign and symptoms of COVID-19 may appear 2 to 14 days, 2 to 14 days after exposure. And the signs may include fever, cough, shortness of breath, or difficulty breathing. Other symptoms include tiredness, aches, runny nose, sore throat. Now, some persons would have experienced loss of smell or loss of taste as well. Severity of COVID-19 symptoms. The severity of the COVID-19 symptoms can range from very mild to severe. Some persons may have no symptoms at all, and this is what makes it dangerous. This is why we need to safeguard ourselves, because persons might be in our presence that they're not showing any symptoms. But recently I spoke to a doctor and she was saying that persons not showing symptoms has the ability to infect up to 100 persons or more before they even show symptoms, and that is if they are showing the symptoms. So the infection starts long before the symptoms. Now, exactly how contagious the new coronavirus is. It's unclear exactly how contagious the new coronavirus is. Data has shown that it spreads from person to person among those in close contact within 2 to 6 meters. The virus spreads by respiratory droplets released when someone with the virus coughs, sneezes, or talks. Now, the fact that it spread when we talk, this I'm sure is new for a lot of persons. I was surprised when I was first doing the research, because when we talk, a lot of times saliva comes out without us even noticing. We probably don't even feel it, but it happens. So social distancing, this is the reason why social distancing is so important. Now, it can also spread from persons touching a surface with the virus on it and then touches his or her mouth, nose, or eyes. Now, we're going to look at the surfaces, some of the surfaces that the virus can live on and how long, because this is really what makes it dangerous. You imagine wood. for example, like furniture, decking, anything that is made of wood. The virus can live on wood for 4 days. So let's say you're at a desk, someone that is exposed to the virus touches the desk. You don't know. 2 days later, you weren't at work or you weren't at school, you weren't at wherever you are now, and 2 days later you come and you sit at this desk and you touch it, you can catch the virus, and this is what makes it so dangerous. So please sanitize and clean, and do so carefully. Metal, for example, doorknobs, jewelry, silverware. The virus lives on this surface for 5 days. Plastics, for example, packaging like milk containers, detergent bottles, subways. You're using the bus, you're buying a drink, whatever it is that is in a plastic container, the virus lives. It can be like the elevator button, as simple as the elevator button. Backpacks, the virus lives for 2 to 3 days. So you go into an elevator, you had no knowledge that someone has used the elevator with the virus before. This person might not even be showing symptoms, and they use the elevator. You use the elevator a day or two after. You touch that elevator button. Guess what? You can catch the virus. Stainless steel, for example, you have refrigerators, pots, pans, sinks, and even some water bottles. See how important it is that we sanitize and do so daily? Well, as a matter of fact, hourly, as often as we can. So on stainless steel surfaces, the virus lives for 2 to 3 days. Cardboard, like shipping boxes, food boxes, drink boxes, anything that is made of cardboard, 24 hours, that is still a very long time for someone to touch it and contract the virus. Copper, for example, money, the silver, tea kettles, cookwares, lives on them for 4 hours. Again, clean, 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 sanitize. Aluminum, for example, soda cans, tin foil, water bottles, it lives on those surfaces for 2 to 8 hours. Glass, for example, your drinking glass, your measuring cups, mirrors, windows, lives up to 5 days. For a lot of persons that takes a public transportation, I was recently on a bus, I was sitting at the window. When I'm embarking the bus, I try not to touch anything, just to step up. So I'm not going to enter a bus that is moving or their attempt to move or anything, because I'm not holding on to anything as much as I can. And I was sitting on the bus and someone was trying to pry the window open. You imagine that someone was sitting on that bus before with the virus, was trying to do the same thing, and then this person comes. Because for a lot of the buses, except for like the JUTC buses, they're not been cleaned. Or if they're not being sanitized, or if they do, not very often. And a bus person set the bus like for the entire day. So to be safe in a bus, it has to be clean like after every trip, which I'm sure is not being done. So we need to be careful, very careful. And the virus lasts up to 5 days. Drinking glass, mirrors, cups, windows, 5 days. Ceramics, dishes, pottery, mugs, tiles, 5 days. Paper. And for paper, this is the one that it lasts very long, up to 5 days. And I think this is very dangerous, especially if we're still at work. For most persons, if you're at work, you're using paper. And for a lot of time, the paper that you use, you're not the only one. It probably passed from one person to the next, and guess what? How can we sanitize paper? So that makes it very dangerous. So the length of time varies. Some strains of the coronavirus lives for only a few minutes on paper, while other lives up to 5 days. Well, we're now at the second strain of the coronavirus, which is the COVID-19. So I'm guessing that this is the one that lasts for 5 days. So that's the one that we're dealing with now. So for paper, 5 days. It means there that we have to sanitize our hands and our desk. Because we can't sanitize the paper. What can we spray on the paper with information? Not to damage the paper, but just to sanitize it. So that makes it very dangerous. So again, we have to sanitize our work area and keep our hands well sanitized. Okay, so some of the risk factors. So risk factors of COVID-19 appear to include recent travel from residents in our area in which the ongoing community spread of COVID-19 is determined by the CDC, which is the Center for Disease and World Health Organization. So Center for Disease Control and the World Health Organization. Now, close contact with someone who has COVID-19, such as when a friend or a family member or a healthcare worker takes care of an infected person. So in the case of the outbreak in St. Catherine, which they should now be quarantined, they should be staying in St. Catherine. But we're seeing in the news, well, not the news, social media, a lot of it where persons are trying to get out to stay with family members, not to be in a situation where they're quarantined. Right? This makes it dangerous. Very dangerous. How do we know who have the virus when persons can have the virus up to 14 days? And I'm thinking longer as well for some persons, depending on their immune system, before we start showing symptoms. Right? How do we know that our family member or a friend that is leaving from a particular part that is quarantined to stay with you because they don't want to be quarantined? How do we know that this person don't have it? Hear what this is going to do. It is going to cause a wider spread of the virus. The government is asking to quarantine persons in their community or their parish for a reason, right? To diffuse the rapid outbreak. And if we're moving from area to area, trying to avoid being quarantined, this is making it dangerous not only for us, our friends, or family member, and for wider society. It means it is going to take far longer to contain. And then we're going to be in trouble. Now, some of the complications, although most persons with the COVID-19 have mild or moderate symptoms, the disease can cause several medical complications and lead to death in some people. Now, older adults or people with existing chronic medical conditions are at greater risk of becoming seriously ill with COVID-19. Now, some of the complication which is associated with the COVID-19, pneumonia in both lungs, organ failure in several organs, some of the preventative measures. Now, although there is no vaccine available to prevent the infection with the new coronavirus, you can take steps to reduce your risk of infection. Now, the World Health Organization and the Center for Disease Control recommend following these precautions for avoiding COVID-19. Avoid large events and mass gatherings. Avoid close contact within 6 feet to 2 meters with anyone who is sick or has symptoms. And since we earlier realized that persons can be sick, can be carrying the virus for up to 14 days or longer, again, it depends on the immune system, without showing any symptoms, I'm thinking it is best to just, whether they're sick or whether they're showing symptoms, there are no social distancing. Keep distance between yourself and others with COVID-19, especially in communities where the virus is spreading. Wash your hands often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer that contains at least 6% alcohol. And just bare alcohol with at least 60% alcohol base can be used as well. Cover your mouth and nose with your elbow or tissue when you sneeze or cough, and throw away the used tissue. Avoid touching your eyes, nose, or mouth. Avoid sharing dishes, glasses, bedding, and other household items if you're sick. Clean and disinfect eye touch surfaces daily, for example, a desk, the pipe, the doorknob. Now stay home from work, school, and public areas if you're sick. Unless you're going to get medical care, avoid taking public transportation if you're sick. And again, Minister of Health would have given a number to call in the case that you suspect that you have the virus, so they can tell you exactly what to do and where to go, and that you can find on Minister of Health's website as well. The CDC recommends wearing cloth face covering in public places such as the grocery store, where it is difficult to avoid close contact with others. It's especially suggested in areas with ongoing community spread, for example, St. Catherine. This update advice is based on the data showing that people with COVID-19 can transmit the virus before they realize they have the disease, which is what we spoke about earlier. Now, using masks in public may help reduce the spread from people who don't have symptoms. Non-medical cloth masks are recommended for the public. Now, what can we do to reduce your chance of catching or spreading coronavirus? Clean and disinfect all surfaces and objects in your home office every day. Well, I would say in a few hours, because we saw how we live on surfaces, but if you can do so at least once per day, that would be good. Okay, so areas to clean, well, this is not limited, includes but not limited to your countertops, tables, doorknobs, bathroom fixtures, phones. And phones, I think, is very, very important. Phone is one of the things that we always touch. We're always touching our phones. They're our best friends. They're always in our hands. Right? So it is so important to clean your phone. Keyboards and the remote control is one of those things that we always have. Once you're home, you have the remote in your hand. And also the toilets, very important. Use a household cleaning spray or wipe. If the surfaces are dirty, clean them first with soap and water, then disinfect them. Because cleaning is basically different from disinfecting. Cleaning is removing the dirt, the dust, whatever. Disinfecting is what removes the virus. Keep surfaces clean even if everyone in your house is healthy. People who are infected may not show symptoms, but they still shed the virus onto surfaces. After you visit the drugstore or supermarket, or bring in takeout or food packages, wash your hands for at least 20 seconds with soap and warm water. Do the same thing after you pick up or deliver newspaper, or any paper for that matter. Okay, and this really got me. High blood pressure risk. Data from China and Italy, countries hit early by the virus, show a higher risk of COVID-19 infections and complications in people with high blood pressure. People with high blood pressure are also slightly more likely to die from the coronavirus. Their risk is about 6% higher than the overall population. In China, 25 to 50% of the people who goes to the hospital with coronavirus with high blood pressure or another health condition like cancer, diabetes, or lung disease. In Italy, more than 99% of the people who died from the virus had one of these conditions. 76% of them had high blood pressure, and that makes it really dangerous. So persons with pre-existing health conditions or comorbidity, which means you have more than one condition, have to be very, very, very careful, have to take extra precautionary measures. And I can't express this enough. You have to take extra precautionary measures. If you have a pre-existing health condition, please please be careful.
Make an impact on your career. Earn real money. Get 3 to 4 local and international certification in practical nursing and early childhood education with free CXC or CAPE subjects in 6 to 12 months at Distinction College, located at 26 Hagley Park Road, Kingston, 6 Nugent Street, Spanish Town, and Ocho Rios. Earn global certificates in 3 months in geriatric nursing, phlebotomy, childcare. We have the lowest school fees around. Classes begin very soon. Call us 356-4167.